Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting any of our material. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, courses, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally, and I would love to assist you as well. But I always like to get into my disclaimer, reminding you guys, we know that there's no absolutes in medicines. In medicine, we treat on a patient by patient basis. And I just like to give the disclaimer because when I design these questions, they are based on the current guidelines that are being tested on boards. Okay. And if I'm doing any video teaching you tips and things that we do in practice, as you know, guidelines will vary some for the tests that are currently out because the tests are updated every 3 to 5 years. And so if I'm teaching you on the things that we're currently doing in practice, I will always tell you one versus the other so there's no confusion. Okay. So, with that being said, let's get into question number one for today. All right. So, question number one states a patient presents to the office with complaints of pain to his right wrist and thumb. He denies any recent injuries. Upon assessment, the nurse practitioner has the patient to make a fist, folding his thumb inward so that it is inside his fist as assessing for induced pain at that time. Based on this, what test is the nurse practitioner completing? Is it A, Tinel sign, B, Finkelstein test, C, Phelan sign, or D, the Lockman test? Take a moment and tell me what you got in the comments. All right, you guys. I always recommend reading the stem of the question first so that it slows you down to ensure you're answering what is even being asked. And I know oftentimes you're like, you hear me, you know you should do this, but nobody has time to do this. Trust me, just do it. Do it and watch the difference even while you're practicing. Watch the difference in your exam scores, but also when you get on boards, please, if you don't do anything else, do it on boards, because sometimes we have so much chatter in our brain, we're rushing through, we're taking what we know and we're grouping some of the scenario that has nothing to do with what they're asking you. It's just additional fluff, and you create your own storyline, and then you miss easy questions that you know the answer to. So just take that brief moment to read the stem of the question to make sure you're answering what's being asked. So here the stem of the question states, based on this, what test is the nurse practitioner completing? So what are we talking about here? The patient comes in, they're having right um, wrist and thumb pain. He denies any injuries. The nurse practitioner has him to make a fist, folding his thumb inward so that it's inside of his fist. So this is a knowledge-based question. What test is this describing? Is it A, Tinel sign? No, although that is an assessment for wrist pain, for carpal tunnel, that median nerve pain, but you're tapping on the middle of the wrist into nail sign. T for tap, T for nails. You tap, tap, tap to see if it elicits any pain, right? B, the Finkelstein test. Yes, Finkelstein fist, F and F. But we do the Finkelstein test when we're trying to confirm a diagnosis of de Quervain's tenosynovitis, right? And that's where they have that wrist and thumb pain. And one way to confirm this differential diagnosis is to have them to do the Finkelstein test, have them to make a fist and not just make a standard fist with the thumb outward, making the fist with the thumb inward. So it's under your four fingers inside the fist, because it will elicit that thumb pain and induce that pain at that time for a positive finding. Okay. We know C, Fennell sign, is where you're putting the back of your hands together, also a test for carpal tunnel. And the Lockman test is a test for ACL. All right. All right, all right, all right. Question number two for today. A patient presents to the office for follow up today. She has a history of asthma. Patient is currently taking a low dose ICS and formoterol combo inhaler, PRN. She states that she is waking up at night short of breath at least twice a week. The nurse practitioner assesses for any history of smoking or allergies or any other triggers, and the patient denies. Based on these findings, how should the nurse practitioner treat? Is it A, add albuterol? B, add a low dose ICS formoterol maintenance regimen? C, add Atrovent? Or D, no changes are required at this time. Take a moment and tell me what you got in the comments. All right, you guys, stem of the question states, based on these findings, how should the nurse practitioner treat? And you know what I always say. So if it's asking about treatment or if it's asking you to diagnose or assess, etc., you got to run it back, right? We're going to run it back and see what the diagnosis is, what the assessment is, right? Because we're thinking assessment, diagnosis, evaluation, treatment. And in order to treat anything, we have to have a diagnosis, right? We have to understand the assessment to know what we're treating. So back it up and see where we are. So this person they're always talking about has a history of asthma. She comes in, she's stating that she is waking up twice a week at night, short of breath, right? Subjective findings. The nurse practitioner does her assessment and also asks just to rule out any triggers. Okay, perfect. So we're seeing that it's not any triggers that are causing this, right? So is there something else that we need to do? Yes, because if somebody is having at least if they're having nighttime awakening at least twice a week, that's too much, right? So is it A, add albuterol? No, albuterol is a short-acting beta agonist, right? And when we're doing the Gina for asthma, there's two ways. So either you're going to have them on that short-acting beta agonist PRN, or you're going to go the route of the low-dose ICS for Meterol combo PRN. We're not doing both, right? So you can eliminate A. B, you want to add a low-dose ICS for Meterol maintenance regimen. Yes. So with Gina's preferred approach, because there's such a good response, it decreases the severity and exacerbations and asthma death with ICS for Meterol combo. So they want everybody who has that asthma diagnosis to be on the combo PRN, a low dose combo PRN. But if you are still having troublesome symptoms repeatedly, or if they're having nighttime awakenings more than once a week, then you bump up the stepwise approach. So you're going to need to add in a low dose inhaled corticosteroid plus formoterol maintenance regimen, so that they're not just on a PRN, but they're now taking it daily. And then you're going to continue to assess them. And if their symptoms aren't improving and it's uncontrolled, then of course you continue to bump up. Or if you're seeing that it is controlled and maintained, you can consider bumping them down after 3 months. Okay. Still, we do stepwise approach the same. This is just a different medication formula because they have seen a better response in therapy for patients on this route. Okay. So if they're telling you that they're already on this low dose ICS formoterol combo inhalant, and they're on the PRN, but they're continuing to have these worsening symptoms, you're going to need to bump up and at least put them on a maintenance. Okay. That's step 3 is where we bump up to that. Okay. All right, and lastly for today, question number 3 states the nurse practitioner and NP student are discussing contraindications of thiazides. All of the following are correct except A, a history of gout, B, a sulfa allergy, C, history of heart failure, or D, hypokalemia. Take a moment and tell me what you got in the comments. All right, you guys. So, stem of the question states all of the following are correct except reading that stem helps you slow down so you're not missing keywords like except, right? So, the nurse practitioner and NP student are talking about contraindications of thiazides. So, we're looking for the outlier, the one that is wrong, right? Because all of these are correct except. So, a history of gout. No, that's correct. B, sulfa allergy. That's correct also. C, heart failure. Nope, that's calcium channel blockers, right? Patients with a history of heart failure is contraindicated in for calcium channel blockers, not thiazides. And D, hypokalemia. Yes, I always talk about electrolyte imbalances. You always want to watch for patient on thiazides, but hypokalemia is the number one of those electrolyte imbalances because this is one of those common adverse effects that can occur. So definitely hypokalemia, history of gout, so forth. Those are all contraindications of thiazides. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, and subscribe, and share with whomever you may think may find this beneficial as well. But you make sure you meet me back here for more practice questions and tips, okay? And if you need any assistance, any of our review courses, our review book, any of our self paced online courses, or if you would like one on one sessions where you can allot a session if you're just stuck on a certain area and need to get your weaknesses to be a strength, or if it's a little bit more and you need the whole thing, you need the nitty gritty from top to bottom, you've had an unsuccessful attempt, or you're just struggling to structure your studies and you need to gauge where you are and have a plan and have someone to hold you accountable and study along with you, then that's our custom package of one-on-one sessions. And it is geared to your timeline. It's built out based on how many weeks that you're looking to prepare or needing assistance with sessions weekly to work with you as well live. So if you're looking for any of those resources, just reach out to us at the Nursing Studio. Shoot us a call at 803-400-6864, or you can text that number or send us an email at thenursingstudio, the number one, at gmail.com. But meet me back here. Happy studying. Bye, y'all.